Welcome to our podcast. Today, we're exploring the fascinating topic of how experiencing multiple disasters impacts public health. Let's dive in.
I'm really interested in this. What's the main takeaway from the research you've been looking at?
Well, there's this comprehensive scoping review that analyzed 150 studies on multiple disaster exposures. They found that experiencing more than one disaster can significantly affect mental health, physical health, and overall well-being.
So, experiencing multiple disasters has worse effects than just one?
Exactly. It's like the negative impacts compound over time.
Right.
The risks associated with multiple disasters can exceed those from single disaster exposure.
That's really concerning. Why does that happen?
Well, when disasters overlap or happen close together, people don't have enough time to recover fully.
Yeah,
The cumulative stress leads to higher rates of mental health issues like PTSD, depression, and anxiety.
I can see that. And does this affect physical health too?
Absolutely. The stress can manifest physically, and disruptions to healthcare services can worsen health outcomes. Existing conditions might be aggravated due to prolonged stress and limited access to care.
That's something I hadn't thought about. Did the study mention any indirect effects?
Yes, they found that multiple disasters can alter public risk
Oh?
perception. For instance, some people might become desensitized and ignore evacuation orders, while others might experience heightened anxiety.
That must make planning for emergencies even more complicated.
Exactly. Emergency management becomes more challenging when public responses vary widely. Plus,
Yeah.
governments might struggle with communication and resource allocation during multiple disasters.
But wouldn't previous disaster experience help governments and communities be better prepared?
You'd think so, but the research suggests that's not always the case.
Hmm,
Sometimes, the same mistakes are repeated because systems haven't adapted or resources are depleted.
that's a bit disappointing. I would have hoped that we'd learn from past experiences.
I know, right? It's
Right.
clear that more needs to be done to ensure effective learning and adaptation after disasters.
So what about the recovery process? How is that impacted?
Recovery becomes more complex when disasters are frequent or overlapping.
Yeah,
Communities may not have sufficient time or resources to rebuild before the next disaster hits.
it's like trying to rebuild a sandcastle as the tide keeps coming in.
Exactly. And that ongoing struggle can be exhausting for communities.
Did the study suggest any ways to address these challenges?
They did. One key recommendation is to provide widespread mental health support that accounts for cumulative trauma.
Yeah,
Also, enhancing government response through better communication and learning from past disasters is crucial.
are there gaps in the research that need to be filled?
Definitely. There's a need for more studies on how different types and timings of multiple disasters affect people. Also, understanding the impact on marginalized communities is important.
Especially since climate change is expected to increase the frequency of such events.
Exactly. It's a pressing issue that needs more attention.
Right. You know, it's like when you're already juggling too many balls and someone tosses in another one. Eventually, something's got to give.
That's a great way to put it.
Yeah,
People and systems can only handle so much stress before it affects their functioning.
this really underscores the importance of building resilience in communities.
Absolutely. Strengthening social support networks and ensuring access to resources can make a big difference.
Well, thanks for sharing all this. It's given me a lot to think about.
You're welcome. It's an
Yeah.
important topic, and I'm glad we could talk about it.